All right, let's get started. I'm going to take off my mask because we are taking every possible precaution. I assure you, the camera person is far more than 6 feet away and in full PPE. Those beautiful portraits in watercolor in the intro, those were created by Seattle-based artist Jay Shuri Krishnan, and they are portraits of the brave Virginia Mason staff wearing their PPE. Welcome, friends of Virginia Mason. I'm Kevin Joyce, and I am delighted to welcome you to our first virtual event supporting our COVID-19 heroes at Virginia Mason, Dream Builders Reimagined. If you've been to the real live Dream Builders before, you know it's an incredible celebration of the amazing healthcare community we call Virginia Mason. Well, this year, Dream Builders looks very different. Like so much in our lives right now, we are virtual. We are socially distanced to ensure everyone's health and safety during COVID-19. But two things are also true. We can all still be together. In fact, more of us can. And I promise you, regardless of the venue or the dress code, which is tonight very light, this will be an inspiring evening as we raise funds to support the critical work of Virginia Mason. It is auspicious that in Virginia Mason's 100th year, right now, it is positioned as a leader in the healthcare of our community during this profound challenge. Given this year's unprecedented health crisis, your support has literally never been more important. Throughout this evening, we'll be asking for your support of Virginia Mason and its incredible frontline workers with a financial gift. So before we begin, let me point out the graphic here on the screen. You can make your donation at any time by visiting vmcovidheroes.org. But if you are on the go or you don't have time to get back to your computer to make a gift, you can get the link straight on your cell phone by sending a simple text message. So take out your phone, go to text message, and in the phone number area, type 76278. Then in the message box, type the word VM Hero. That's VMHERO, and press send. You'll get a response with a link to the donation page. Don't forget to follow the prompts and click on the link to complete your gift. Now, of course, we want to thank the incredible corporate and business partners whose logos are shown here. These community leaders always step up, but right now they've stepped up even more to assist Virginia Mason with critical support of their programs. If you joined us prior to the program, you probably heard many of the wonderful messages from many of these partners, and if you missed them, stay tuned till after the live program. You'll hear them again. We are so grateful for their generosity, for their cheers of encouragement. With their generosity, we are starting off our night with almost $300,000 in donations, which is remarkable. Joining us this evening are staff from throughout the healthcare system, including the brave frontline workers and healthcare providers in the hospitals, as well as representatives from the command center, the labs, environmental services, engineering, virtual care, and infectious disease. This program will be a very unique behind-the-scenes look at what it is like to be on the front lines at Virginia Mason. The stories are remarkable. You won't want to miss any of them, I promise you. To kick things off, it is a pleasure to introduce Dr. Gary Kaplan, the CEO of Virginia Mason, who has some words he'd like to share about the amazing work the organization he leads is doing during this very difficult time.
Good evening, and thank you for being with us here tonight, albeit virtually. It's really meaningful to have you with us during this very special time in our history. Virginia Mason was founded 100 years ago. We are proud of our many accomplishments, and we remain a very forward-facing organization as we look to the future. It's also an honor to have you with us tonight because many of you have been with us for decades over this journey. And we know that we would not be the organization we are today and the organization we aspire to be in the future without your support. So thank you for all you bring forward to help Virginia Mason be the organization it is today. This has been a challenging time, and none of us thought that we would be facing a pandemic as we celebrate our 100th anniversary. And yet, it's been a time where we've been able to really see the foundation, the core, the essence of Virginia Mason in action. How we think of ourselves and what in many ways makes it special to work at Virginia Mason as well as receive care at Virginia Mason is alive and well. And in fact, during this pandemic, we've seen so many examples of team medicine in action, bringing together our physicians, our nurses, our advanced practitioners, our pharmacists, our social workers, all members of the care team as we work together to create perfect patient experiences. As most of you know, our organizational vision is to be the quality leader and transform healthcare. This has not taken a back seat during the COVID pandemic. And in fact, our focus on quality and safety has never been stronger. And so we will continue to ensure Virginia Mason has the highest quality outcomes of care, as well as the safest possible environment for all of our team members. So while this has been a challenging time, it's also been a time for us to rise to that challenge, a time for our team members across the organization to step up, embrace innovation, utilize that which we know how to do with our Virginia Mason production system, and ensure that our patients, their families, and our community continue to receive the highest quality, safest possible care. As CEO, I'm so proud of what we've accomplished at Virginia Mason over the past 100 years. Our team members are truly heroes. They come to work every day to do their best for you and for all of our patients and our community. So much to be proud of and so much to be thankful for. And we are so grateful to all of you for supporting us through thick and thin during what might be called routine years, if such a thing exists in healthcare, but also during these challenging times. Your support has never been more crucial, never been more important, and we continue to be so appreciative and so grateful for all you do. Thank you, and have a wonderful evening.
Very special thank you to Gary for that message and for your inspiring, nationally recognized leadership. It's incredible to hear about how we are responding to this challenge and to know that Virginia Mason has been serving this community for 100 years. Tonight's event is about recognizing and supporting the team who've worked tirelessly to properly respond to the COVID-19 pandemic for the safety of the patients, the team members, and the broader community. You know, there are so many things that go into caring for us as patients, we have no idea. Virginia Mason's team of caregivers know that it is not all about the medical diagnosis, but how to care for the patients and the families' hearts and minds. From expanding their ability to care for patients virtually to increasing access to technology, every single area of the healthcare system has seen profound changes to the way they operate over the last several months. One of the things that Virginia Mason is most proud of is their response in the End-of-Life Companion Support Program. Developed at the beginning of this pandemic, this program was created when visitor access was at its most limited. Virginia Mason is the first medical center to create a process to allow family members to say goodbye to their loved ones. Let's hear about how the team has addressed this new standard of care from the staff themselves.
My husband and I were on vacation in Hawaii, which is a rare thing. And we were having lunch and he got a phone call from his colleague. And I didn't know what the phone call was about, but he was on and on and on and talking very animatedly. And he came back and said, "We have a COVID positive at Virginia Mason."
This was at a time when I think nobody really anticipated what was going to happen. Many of us were skeptical, thought it was overblown, but clearly it wasn't.
Were we going to get 3 other people that weekend, or were we going to get 50 that weekend? And so was this going to be a gradual buildup, or was it going to be a tsunami?
Going in and putting my PPE on for the first time and going into the room, and like, I know that there's a potentially deadly virus that this patient has. And that's when it hit me like, okay, the world has changed. This is not the way it was 2 weeks ago.
I think the biggest challenge with COVID has been the lack of connection that family members get to have with these unbelievably critically ill people.
There's something that's so heartbreaking about not only did you lose your grandmother a week ago, but that your mother is still really sick. and you can't come see her right now. There's so much more complexity to the things that our family members have to worry about than just, I can't be by this person's side. It's like, there are just so many more consequences.
I can't imagine what it'd be like to be told, no, you can't do this because of your own safety, the patient's safety.
But I was caring for a patient, and we'll call him Mr. A, and Mr. A was admitted with COVID-19 viral pneumonia, and he was actually doing fairly well. He was off of oxygen. And unfortunately, his wife of many decades was across the street at a different hospital, and she also had COVID-19 viral pneumonia. And she unfortunately wasn't doing as well as he was. And one morning we got a call that she was unfortunately placed on comfort measures, and she didn't have very long to live. And so everybody involved, and I want to give so much credit to the care team, rushed to get him an iPad and get his wife at a different hospital an iPad as well, so that they could say goodbye. And unfortunately, we were a little bit too late, and she had passed before we were able to get them to say goodbye one last time. But for him, it didn't matter. He still asked the nursing staff at the other hospital to put the iPad up next to his wife, prop her up in bed, and he proceeded to speak with his now deceased wife about their life together. As physicians, we lose patients from time to time, but we never think that they're not going to be able to say goodbye to the patients that they love. And this virus now has put us in a position where we're using iPads to say goodbye to each other.
A group of us were sitting down with some executive leaders to talk about, do we allow visits at the end of life, or do we not? Because many hospitals are not allowing those visits. And one of our executives said, we're Virginia Mason, and we can figure this out, and we can do it, and we can do it safely.
We have a rule right now that at the end of life, a patient can have 2 family members for 30 minutes. We're able to set them up with the PAPR, bring them into the room, and have them have an opportunity to say goodbye.
It's about the patient, and it's about loving healthcare. And I enjoy the fact that even though I'm a supply person, everything that comes into the hospital through me and my team is going to make somebody's life better.
When we get donations from the community, it just is nice to have people behind you. Sorry. But you know, our staff are dealing with pressure at home, and then there's pressure on the staff when they're here to be the rock. And they've got to be the rock for the patient.
Even in the hardest times, we're going to think about things differently. We're going to try to be innovative while still maintaining really good, safe care. And it made me really proud to be a part of the team here at Virginia Mason.
I know I'm not alone when I say I'm blown away by those stories. These heroes are literally putting their lives on the line to care for others, and it is so inspiring. Being together, even virtually like this, is so important right now. We want to take a moment to recognize those who have lost their battle with COVID-19. For all of us, for anyone, the importance of being able to say goodbye to a loved one at the end of their life cannot be overstated. An important part of this event is to emphasize how much the support of the community means to those who are risking their safety and the safety of their own families by going to work every day. Virginia Mason has done such a fabulous job in ensuring the safety of their staff and their patients. We've had the best outcomes for our COVID-19 patients, not just in the region, but in the country. So many incredible things happening at Virginia Mason during the pandemic, the kind of innovation, commitment, and efficiency that makes this institution so remarkable. All of the steps Virginia Mason is taking right now to fight this pandemic and keep each other safe. This includes the use of PPEs, changes in cleaning protocols, screening of team members and patients entering the facility, limiting access to reduce exposure, expanding virtual care, and encouraging patients to get the care that they need to continue to stay healthy. All this is needed to treating patients who are fighting for their lives, while also keeping other patients and team members safe and healthy. But none of these measures would be possible without all of our support. This battle, and it is a battle, is not restricted to our frontline workers, but it's fought by everyone in our community, and this is where we come in. This is where you come in. We have so many people stepping up with gifts this evening. I'd like to specifically recognize donors who are generously extending themselves with donations of $10,000 or more. We have such gratitude for every donation that is coming in, and many are coming in right now. Thank you so much to Pam and Jay Green. Thank you to Dr. Gary and Wendy Kaplan, to Rob and Pam Walker, to Lonnie and Susan Edelheit, to Jean and Peg Larson. These are just some of the folks that are generously supporting Virginia Mason tonight, right now. And we have something very important, and for a fundraiser like me, very exciting to announce. And it's the result of a critical relationship with an amazing couple of people who many of you know, who have been right at the heart and soul of both this larger community and Virginia Mason for many years. Bringing to you a special announcement from Phil Condit.
We need heroes, not the splashy media heroes, but the ones that face risk every day to keep us safe and well. The doctors and nurses and staff at Virginia Mason. That's why my wife Gita and I would like to match your gifts that help to support these real heroes. Thank you.
How incredible. Phil and his wife Gita have generously agreed to match the next $50,000 in donations. So if you haven't made your gift yet, now is the time. This challenges all of us to step up as generously as we can and support Virginia Mason's work at the forefront of the COVID-19 crisis. Take advantage of this incredible opportunity to double your impact for Virginia Mason. As a reminder, you can make your donation by visiting vmcovidheroes.org, or you can text VMHERO, that's VMHERO, to the number 76278, then follow the prompts. Thank you to the donations that are coming in. They keep coming in. Dick and Dawn Bangert, thank you so much. Dr. Dick and Linda Kozarek, thank you very much. Doctors Richard Fagley and Amy Lee, Baird and Cheryl Stevenson, Barbara Christensen, your donations and all the other donations that are coming in right now are truly a kind of engagement with this community, and it goes way beyond that for an incredibly dedicated group that helped lead this organization. And we now get a special message from our board chair, Jan Hendrickson.
So tonight is all about celebration, the celebration of the extraordinary measures that our healthcare heroes are taking to keep us safe and healthy. And they do this day in and day out. And they've been doing this under incredible stresses these last few months. As you are each so well aware, their commitment to quality, to safety, to incredible care is remarkable. And yet we expect it from them every single day because that is what Virginia Mason does. So as I think about tonight, I think about how we need to be here for Virginia Mason. That is the other half of the celebration. Our support matters. It really matters, and especially during a time like now. So tonight, the celebration has two purposes: to celebrate our healthcare heroes and thank them, and for us to show up for Virginia Mason. Just as we count on Virginia Mason to provide us the most amazing care every single day, our support matters. So please, please give generously.
Our community leadership has never been more critical and never more effective than it is right now. Everybody has stepped up, from volunteers to every part of the system of care. So many Virginia Mason teams have done world-class work during the pandemic. The teams that have led and innovated on intubation, on providing care for the providers, on supporting teams to use PPEs correctly, on cross-training the nurses, on surgical and procedural testing, on infection prevention, on the labs and the extensive lab work to support the testing of patients and team members. Tonight, we have an amazing and very unique opportunity to hear brief messages from 6 different departments in Virginia Mason's system-wide approach. First, a message from the Command Center. This is Senior Vice President of Administration, Charlene Tachibana.
My name is Charlene Tachibana, and I oversee quality and safety here at Virginia Mason, and I serve as one of the leaders for the command center that was opened in response to the COVID crisis. When this pandemic started, we didn't know a lot about the disease, and so we were working to coordinate with the Centers for Disease Control, the CDC, our own local public health, our state Department of Health, and establish standards of care and understand what we needed to do to keep patients and team members safe. Obviously, there were also shortages of supplies, personal protective equipment, and so much of the work of the command center was how do we deploy those in a way that is safe for everybody involved. The generosity of our community and the donations that we have received have been extremely meaningful to us. Thank you.
Such tremendous internal leadership in this organization right now. It's part of what makes Virginia Mason such a unique healthcare institution and a community leader in the midst of this crisis. And this is where your support matters. This is our spotlight on giving. We do it at Dream Builders Live, and we're doing it now virtually. Your donation will support all these amazing parts of Virginia Mason to function at their highest capacity. Donations are coming in right now. We want to thank Todd and Donna Rosenberg. We want to thank Dr. Richard Meyer and Susan Harmon. We want to thank Jim Young, Con and Constance Smith, Peter and Beth Goodman, and I'm excited to announce that the gifts that are pouring in have taken us over the $50,000 mark for the Condits match to be activated. The gifts keep coming in. Thank you all so much. It matters so much, and it means the world to all the providers and to all of us. And now another group that's been at the very heart of this work, infectious disease. This is the department that is creating safe practices and communicating with regional and national agencies about the ever-changing direction of treatment. They are also treating COVID-19 patients and leading Virginia Mason's efforts. Let's hear from Dr. Christopher Baliga.
So I'm Chris Baliga. I am one of the infectious disease doctors here. I am also the medical director for infection prevention and employee health. One of the things that I found most inspiring about the pandemic has been the response of both our teams here at Virginia Mason as well as the community. We have taken COVID-19 patients from when nobody knew what it was to today and provided care that has led to really good outcomes. Our patient survival rates are better than most hospitals in the region and in fact in the country. And then I'm very inspired by our patients who have had to walk the path of COVID-19. And then for the patients that haven't left the hospital, for them and their families, I don't think they see me crying in the corner or crying at night, but I feel for all of them. And it's just been a truly emotional experience for me.
That right there is so emblematic of Virginia Mason's world-class excellence in specialized care, and it's right here in our community. We have gifts that are coming in right now, and we want to thank Heidi Jansen, Dornan Ball, Jim and Sally Casey, Bruce and Camille Winter, Dr. Stephen and Patricia Anderson, Susan and Roger Hansen, all these gifts that are coming in, and there are scores of them. Your contributions truly mean the world to the caregivers, to the staff, and of course to the patients. To give, again, text VMHERO, VMHERO to the number 76278. Press send. You'll get a response with a link to the donation page. Just follow the prompts to complete your gift. And of course, you can make a donation at any time by visiting vmcovidheroes.org. And now we get to hear from some truly behind-the-scenes heroes, but a critical component in creating a smart, well-researched approach to the pandemic. Here is Leanne Lewis, Senior Director of Ancillary Services and General Lab.
So my name's Leanne Lewis. I'm the Senior Director of Ambulatory Laboratory Services here at Virginia Mason. In the response to COVID, the lab has been a key element to performing the tests that determine whether the patient has an active case of COVID or not. Just getting that process up and running was tremendously busy for our team. Especially when we first started, you had to think that we were preparing for a wave of patients, and so how quickly can we respond and know whether someone was positive or negative and be able to put them in the right place in the hospital was critical. To date, we've run over 18,000 tests in our own laboratory. And we began with the process of first, in February, sending them out to the health department and then to the University of Washington to bringing on the test internally. So we went from days turnaround time to being able to report back to our clinicians within hours. So this was critical for the running of the hospital. I'm really proud of the work that the team is doing to ensure that we are able to operate in this organization and keep it up and running. Sometimes you feel the burden that the lab is considered often an ancillary service and they're behind the scenes, and now we're at the forefront of ensuring that our doors are open.
That helps us see, and many of you who know healthcare systems and know Virginia Mason, how incredibly well coordinated these distinct teams are. It's one of the really unique things about this institution, how they all rely on each other for excellence, for collaboration. We are just so grateful for the gifts that are coming in right now. We want to thank Doctors Mike and Lucy Glenn. We want to thank Doug and Nancy Boyden. We want to thank Susan Brown and Jean Heitz. Know that you are making a world of difference. You're literally saving lives. We want to thank everybody for every gift that is being sent in. You can give once, you can give more than once. You will thrill the folks who are doing this hard frontline work. Because of the planning and development that Virginia Mason has been engaged in for the last several years, they have been uniquely set up for the rapid deployment of virtual care, giving patients the right care at the right time with the right team, enabling providers to monitor patients while they stay at home with a high level of security and the most advanced technology available. It's incredible service. Here's a message from Karen Gifford, the director of our virtual care team.
Hello, my name is Karen Gifford, Senior Director in the Hospital Acute Care. And my role in the COVID response was really focusing on virtual care. So making sure that we could provide the care to our patients where they needed it, when they needed it, with our providers, whether it was in the clinic or in their homes. With COVID, our patients no longer really wanted to come into our brick and mortar, our clinic settings, because of just the risks with potential to be exposed. So we really had to rethink and gather together and bring our care to the patients where they wanted it, when they wanted it, and in the way they wanted it. And that was really into their home setting. In a recent satisfaction survey that we did, 97% of the patients were satisfied with the interaction that they had with our provider. And that equals, or and sometimes was better than, the in-person visit.
This is the work that VM has been preparing for and engaged in for several years. And as you can see, laying that groundwork has allowed Virginia Mason to truly level up during the pandemic and lead the way in virtual care. Folks, you can make your donation at any time by visiting vmcovidheroes.org. Here are some gifts we want to acknowledge. We are so grateful for everybody that's contributing right now and is going to contribute throughout the rest of the program. One simple way to give is on your phone. Just text VM Hero to the number 76278. Press send. You'll get a response with a link to the donation page. Just follow the prompts to complete your gift. And of course, you can make that donation anytime at vmcovidheroes.org. As you can imagine, every single part of Virginia Mason's system has been reviewed and meticulously managed and remanaged in response to COVID. So let's hear about a key part of the infrastructure, environmental services. Here is Ryan Creganow.
My name is Ryan Creganow. I have been an operations manager for the environmental services team here in Virginia Mason for a few years now. When the COVID situation began, we started responding by making sure we were keeping our team safe, organizing ourselves to make sure that we were not putting anyone in any danger, keeping all of our areas clean, and just stockpiling PPE and gear to make sure that we were all protected. We were keeping our housekeepers who were at a certain age or in danger of COVID-19 or were nervous. They were sent to other floors where they could still be used and still be helpful throughout the hospital, but not put in any danger. We really wanted to focus on making sure that every housekeeper was confident that they were not going into a room that I myself wouldn't go into, or a nurse or a doctor wouldn't go into. I mean, they're my family. I've known them since I was a transporter 7-8 years ago. It was very important to me that if they had questions, they could stop and ask me and I could give them an answer, or at least have the confidence to tell them, I don't know, let me find out, let's find out together, so that we're never going in there guessing.
As we've all seen, because the news has been so intense and so relentless, hospital systems across the country are reeling under the weight of the pandemic. Virginia Mason is leading by example in so many areas, and we are succeeding. Thanks to all of you for all of your support as we're having this event. We really appreciate you all digging deep, giving to support the incredible frontline workers. Nothing is more important in a hospital system than feeling safe, than feeling like if you have to be in a hospital, you don't want to be anywhere else but there. Throughout the entire system, Virginia Mason is working in the midst of this crisis to make sure patients, families, caregivers, and staff all feel that way. Here's someone who knows all about making that need a reality, the Director of Engineering, Safety, and Regulatory Compliance, no small task, David Kay.
My name is David Kay. I'm the Engineering and Environment of Care Director here at Virginia Mason. My team makes the environment safe for the staff and patients. This is not business as normal. We had to change the environment very quickly and on a grand scale. We did this by bringing in negative pressure fans, HEPA filtered fans. You think about airflow from corridor through the room and outside the room to keep the patient safe and the staff outside of the space safe. Well, I'm extremely proud of my team. As a group, our work is saving lives. None of us can do it by ourselves. Each department plays a role. The real heroes in this are the patient care staff, the nurses and the doctors and the PCTs and everybody that has been providing direct care. If there's anything nursing can do to rectify the problem, they do. If they have to plunge a toilet, they do that. If they have to unplug a sink, whatever it is, they would rather do that themselves. They're the ones that are caring for, everybody, my team included, and so they're the heroes here.
What an amazing group of people, right? And what incredible, inspiring stories, and how amazing to have the opportunity to actually hear them. And now it's important to share them. All of it only happens because all of us care and all of us join this effort together. And it is together that we will get through this and that we are getting through this. I want to thank Carolyn Corvey and John Bates for their donation. We want to thank everybody who's contributing. There's so many contributions coming in right now. It matters so much, everyone, and we are so grateful. Ladies and gentlemen, in our short time together, we have done very, very well. I don't know if we have the number just yet. Not quite. We're waiting for it. But the donations continue to pour in right now to support the COVID-19 heroes. Every dollar you have given, so many of you have given this evening, will help ensure that the Virginia Mason Health System can continue to keep our community safe and healthy through innovative and compassionate care. We're gonna check. I'll say talk amongst yourselves, but you may be watching by yourselves, or we're waiting for 1 second. So I've had an incredible experience preparing for this and being on calls, the relentless Zoom calls that we're all on, to share with the team who's creating these videos the stories that have been coming in. And they've had to edit them. And it's amazing the stories that they've had to leave out, but they've been able to capture them. I hope you will share this video with friends and colleagues and families who may not have been able to join us tonight. because over the next several months, this work is going to continue and in all likelihood get even more intense. I have a message coming in with a dollar amount. In the short time that we were together tonight, and with people's incredible generosity, we've raised $930,000. $930,190 to be specific. Please help us raise even more critical funds to rise to this challenge of COVID-19. The donation site will be open throughout the week. Be sure to share the video with your friends and family who weren't able to join us. Help us share these incredibly inspiring stories. They're so important to tell of our brave Virginia Mason heroes with our entire community. To everyone who joined us this evening, thank you for being here. Your support is so appreciated. Stay tuned for information about Virginia Mason's upcoming virtual auction, Swirl, to support Bailey Boucher House, and hear messages of support from tonight's corporate partners. That's coming next. We will see you next time. Ladies and gentlemen, be well, be safe, stay optimistic. We will get through this. Thank you for joining us. Good evening.
Hello, my name is Matt Welch, Vice President of Revenue Management at Boeing and proud board member of the Boeing Classic. During these unprecedented times, we would like to extend a sincere thank you to all the COVID-19 healthcare heroes and all the frontline workers that are working tirelessly to keep our communities safe. Thank you.
To all our Virginia Mason healthcare heroes, thank you for all your efforts as we continue to work and serve our communities during the challenges of the COVID-19 crisis. You and your dedication are appreciated during these difficult times. Thank you.
I'm Kim Holcomb from King 5's Evening, and I just wanted to say how much we support everyone at Virginia Mason. We are so grateful for all of the research that you do and the great care that you provide our community. So we salute you, our COVID-19 healthcare heroes.
Hey, Virginia Mason family.
I'm Jana Arnold.
And I am Chuck Arnold, president of your Seattle Seahawks.
And together, we're part of your Dream Builder team.
We wanted to take this opportunity to say thank you for all of your tireless efforts over these past 5 or 6 months. You are the true heroes of our community, absolute rock stars. So thank you so much. Keep up the hard work.
Thank you.
This is Andrew Forrester and Bruce Bush from NPP. We want to thank Virginia Mason for their leadership in the fight against COVID.
Thank you to our COVID-19 healthcare heroes. Without your efforts and sacrifices, we could not get through this alone. Thank you.
My name is Lisa Goodman with the Benaroya Company. We want to thank Virginia Mason's COVID-19 Healthcare Heroes. All of us at the Benaroya Company appreciate and proudly support Virginia Mason's extraordinary commitment to tackle COVID-19 and the amazing team who are helping people who are sick and helping people stay as healthy as possible while continuing to serve all patients in need.
At times like this, it's kind of nice to pause for a moment and to celebrate some of the things that make this region a great place. And one of the things that makes our region in Puget Sound a great place is Virginia Mason. Thank you so much to all the hard and incredible, passionate work that all the medical community at Virginia Mason is doing to make our place safe and caring and loving. Thank you so much.
Thanks a lot. Your dedication is really inspirational. We appreciate it.
Hello, friends of Virginia Mason. My name is Brad Parberry from Cavallini Papers in San Francisco. It has been a joy to work with Virginia Mason through the years, and we look forward to continuing working with Virginia Mason because of their incredible stewardship. Thank you.
Hi, I'm Markel Wiskanska. We want to thank and recognize all of the heroes at Virginia Mason who've been fighting COVID-19. Everyone who's been caring for, healing, and meeting the healthcare needs of our community through this challenging time. I want to recognize and thank the doctors, the nurses, housekeeping, operations, maintenance, the support staff, everyone who has been there battling through this pandemic. Thank you.
Hi, this is Mark Cosentino at Northern Trust, and on behalf of everybody at Northern Trust, we just wanted to say thank you to the COVID-19 healthcare heroes, everything that you're doing in the community each and every day, your leadership and your sacrifice. Thank you from the bottom of our hearts. And also, we are just so proud of the partnership that we currently enjoy with Virginia Mason. Thank you again.
Open Square has never been more proud to be a corporate partner of Virginia Mason. Thank you so much from the bottom of our heart. You are our true hometown heroes.
A big thank you from all of us to all of you.
Thank you to everyone at Virginia Mason for what you've done and continue to do to fight COVID-19.
Sending a huge thank you to all you wonderful heroes.
Thank you so much.
We have been a corporate partner with Virginia Mason for over 7 years, and we are proud to support Virginia Mason in transforming healthcare in our community. We want to extend our gratitude and thanks to all those healthcare heroes that are providing such great care and commitment during this COVID-19 pandemic. Thank you for everything that you do.
Tansy Lovato, Senior Network Executive at Primera Blue Cross. Thanks, VM, for being such a great partner and taking such great care of our members.
Hi, I'm Keith Conti, President of VECA Electric and Technologies. I want to take this opportunity and thank all of the COVID-19 healthcare heroes at Virginia Mason. VECA Electric has supported Virginia Mason for many, many years. And it's at times like this, when we see Virginia Mason's heroes go above and beyond, that we know we have made the right choice. Thank you.
On behalf of Bank of America, I'd like to extend a heartfelt thank you to all of Virginia Mason's COVID-19 heroes fighting on the front lines every day. My mother fell victim to COVID-19. The amount of pain she was in, the PPE doctors and nurses were donning, and how careful they were around her made her think that she was never going to see us again. Thankfully, she is fully recovered and sings the praises of the doctors and nurses who were so compassionate and attentive, just like yourselves, during her battle. For that, I thank you for your strength, your courage, and your sacrifice.
From all of us at Honeywell, we would just like to thank all you healthcare workers on the front line.
Thank you, Virginia Mason healthcare workers, for keeping us all safe.
Thank you, Virginia Mason healthcare workers, for keeping us all safe. We really appreciate it.
Our team at KPMG wants to thank Virginia Mason and all of your COVID-19 heroes for all that you've done for the community. Keep up the good work.
At OAC, we are proud to provide construction management services,
so the Virginia Mason Healthcare Heroes can focus on the best care in our communities. Thank you, Virginia Mason.
Hi, I'm Taylor Collins with Professional Benefits, and we just want to reach out and say thank you to the Virginia Mason Healthcare Heroes.
I'm Jim Tollerton. We've been proud to serve the needs of the physicians and executives at Virginia Mason for over 30 years now and hope to continue in the future. Thanks.
To all of the Virginia Mason COVID-19 healthcare heroes, thank you for all that you do.
Thank you.